Welcome to the Explainer. So picture this. A top public health official quits out of nowhere, claiming she was working in an abusive environment. Is that just a bit of office politics, or is it a sign that something is seriously wrong inside one of the state's most important agencies? Today, we're going to dig into a string of really troubling events inside Nevada's largest state department to figure that out.
And it all starts with this one quote. Wow. This is from the resignation letter of Dina Schmidt. And for a very, very short time, she was one of Nevada's most senior public health officials. When she walked out the door in August of 2024, after just a few weeks on the job, she basically ripped the curtain back on what she says was a toxic culture at the highest levels of the government.
So who was Dina Schmidt? Well, she was the administrator for the Division of Public and Behavioral Health. That's a huge job, right? It's all about overseeing the health and safety of everyone in Nevada. And she lasted just 2 months.
And let's be clear, her letter wasn't vague at all. She didn't mince words. She pointed the finger directly at her boss, Richard Whitley. He's the guy who runs the entire Department of Health and Human Services. You'll hear it called DHHS. And she basically blamed his leadership for why she had to leave.
Now this guy, Richard Whitley, he's not new to the scene, not by a long shot. He's been a Nevada state employee since 1986. Do the math. That's nearly 4 decades in public service. He's been the top dog at this massive agency for almost a decade of that time.
So when you have a high-level official quit this publicly, you have to ask, right? Is this just 2 people who couldn't get along? Or is this resignation a giant red flag, a warning sign that there's a pattern of serious dysfunction inside the very agency that's supposed to protect the health of every single Nevadan?
To really get to the bottom of this, we've got to rewind the clock a bit. Because it turns out, just a few years before Dina Schmidt resigned, and under the very same leadership, this department was smack in the middle of another huge crisis, a truly catastrophic failure during the COVID-19 pandemic.
Okay, so think back to 2022. We were at the height of the pandemic, and everybody was desperate for reliable testing. So state and local governments in Nevada hired this company from Chicago called North Shore Clinical Labs. They were supposed to test thousands of people, from college athletes to state workers.
But here's the thing. There was a massive, and I mean dangerous problem. State officials started noticing some weird, conflicting results, so they had their own lab take a look. And what they found? It's just stunning. North Shore's PCR tests, which are supposed to be the gold standard, right? They were missing 96% of positive COVID cases. Let that sink in. Thousands of people who had COVID were being told they were in the clear.
You can just feel the alarm bells going off inside the state's own labs. The state's top lab supervisor used the word catastrophic. It meant that people thought they were safe, so they went back to work, back to their families, all while potentially spreading the virus. So how on earth did a company with testing this bad get a huge state contract? Well, when reporters dug into it, internal emails showed that a really powerful lobbyist who, get this, used to be the director of the department himself, helped North Shore's application jump to the front of the line. One state inspector even complained they were getting preferential treatment. And on top of that, county officials signed on the dotted line even after their own scientists were raising red flags about the results.
And what's really striking is that this pattern, overlooking warnings from your own experts, failing to protect vulnerable people, it wasn't some isolated incident. In fact, if we go back even further, before the pandemic, we find another crisis that happened under the very same leadership. This time, it involved taxpayer-funded group homes.
This whole story kicked off in 2016, when a company that ran homes for people with severe mental illness just suddenly closed up shop. And when they did, it revealed that people were living in just awful, squalid conditions. That triggered a full-blown legislative audit, which came out in 2018. It confirmed there were huge, widespread failures, and it forced the Department of Health and Human Services to scramble and submit a corrective action plan.
And when I say awful conditions, listen to what the auditors actually found. We're talking leaking toilets, filthy kitchens, medicine not being secured, spoiled food, just basic health and safety gone out the window. And remember, these were homes for some of Nevada's most vulnerable citizens, and the state's oversight had completely and utterly failed them.
So the audit basically laid out a roadmap for how to fix this. And it wasn't rocket science, it was common sense stuff, right? They called on the department to come up with real punishments for providers who failed, to actually do regular inspections, to keep track of problems to make sure they get fixed, and to create basic policies to protect the people living in these homes. Basically to do the job they were supposed to be doing all along.
Okay, so with all of these failures spilling out into public view, the state government had to do something. And to their credit, both the legislature and the governor's office started taking steps to try and fix these broken systems.
After that damning audit of the group homes, lawmakers passed a new law called Assembly Bill 46, and it basically said, okay, we're changing the rules. It created a new certification process, it mandated that the state had to inspect these homes before renewing their licenses, and it required the homes to prove they had enough money to actually operate safely. And the reforms didn't stop there. More recently, in 2024, after the testing mess and all these other issues, the governor pushed for a huge reorganization. The idea was to take this one giant, sprawling Department of Health and Human Services and split it into two smaller, more focused agencies, hoping that would make them easier to manage and hold accountable.
So, you've got new laws on the books, you've got a whole new structure for the department, which brings us to the million-dollar question. Have these reforms actually fixed the real underlying problems?
And this is where we come full circle, right back to where we started. Because when you step back and look at the big picture, you see this real tension. On one hand, yeah, there have been some major structural changes, but on the other hand, you've got some very powerful constants. You've got the same director who's been at the helm since 2015, overseeing every single one of these crises. You've got a clear pattern of major oversight failures, and now you have these fresh allegations of an abusive, intimidating culture coming from the very top. And that leaves us with this one fundamental question. You can rewrite all the regulations you want. You can redraw the boxes on the organizational chart. But if the culture, and more importantly the leadership that was in charge during all the past failures, stays exactly the same, can you really, truly fix the system? Can you prevent the next crisis from happening? That is the challenge that Nevada is facing right now.